Hi, my name is Jennifer Yao, and I am a part-time faculty member at the University of the Pacific Arthur A. Dugoni School of Dentistry. I'm also a private clinician in the Bay Area. I graduated here from University of the Pacific back in 2015 from the Orthodontic program. Previous to that, I was at UCI for my dental school and UOP located in Stockton for my undergraduate studies. Now, before I get into my project and myself, I really want to take the opportunity here to thank the AOF for evaluating my application, taking time to look at it, and offering me and awarding me the Research Aid Award. I'm extremely humbled by this award and am thankful that AOF offers this award to part-time faculty members who are also private clinicians. So onto my project proposal and how I got to it. I was studying three-dimensional cone beam computed tomography during my orthodontic residency for my master's thesis. I worked closely with my mentors, Dr. Hee-Soo Oh, Dr. Gerard Park, and Dr. Sheldon Baumran on my project, and I got to see the potential of CBCT, and I used a lot of programs, including the one behind me, In Vivo, and I just saw a lot of potential with everything and really sparked my research interest. And so after orthodontic residency, I wanted to continue doing this and continue asking questions. And one of those questions is the one I submitted to the AOF, and that's, what are the differences in treatment effects between orthodontic treatment for Class 1 and Class 2 patients? As a private clinician, I see malocclusions in the practices, and I would say Class 2 is definitely a very common malocclusion that I see. Definitely want to know, how does a Class 2 correction get corrected to a Class 1? What contributes to this correction? And so, for example, in an adolescent population, are the effects skeletal or are they dental? Is the mandible moving forward or is the maxilla restricted or moving back? Could it be the mandibular dentition, the maxillary dentition? Could it be the molar rotation, the upper molar rotating mesial in or mesial out, contributing to the Class 2 correction? What contributes to it, and is there a combination? What contributes more then? These are all questions that I have, and the best way to figure it out is through research. And I've been very fortunate to have access to a great set of CBCTs, initial and final CBCTs taken on patients all treated by one really esteemed orthodontist. And these are Class 1 and Class 2 patients, and they're adolescents. And what I plan to do is to use the In Vivo software and take the CBCTs and locate landmarks on these CBCTs, and then use the In Vivo software to come up with the 3D analysis so that I can evaluate the data. The data itself is going to be three-dimensional. I'm going to be looking at both the X, the Y, and the Z coordinates. Okay, so let me just show you real quick on what I'm talking about. Here I have a CBCT of both the initial and final for the patient. The initial is in the white, and then the final is in the blue. So I'm actually able to 3D superimpose the CBCTs virtually on the computer and to be able to look at the differences between the two, see where the major effects are for this particular patient and for all the other patients. In addition, after I put on all the landmarks, I could use this tab, which is the 3D analysis tab. So here are all the landmarks located in the red on the screen. It's very small, I know. And on the right hand side here, in very small red font, here are all the different values I want to look at, all the different linear and angular three-dimensional measurements that I want to evaluate and understand where this is coming from and where the effects are coming from. So using CBCT, I feel like it's very different from the previous two-dimensional analysis using lateral cephalus. Here I'm able to look at not only the anterior and posterior relationship or the vertical relationship, I'm also be able to look at the transfers and look at measurements for things like molar rotation. And I feel like this is the forefront of the orthodontic field, and we're trying to push it and really go beyond it to understand how does treatment work, how can we make treatment more effective, to really critically analyze how we get our treatment effects. So that's where my idea comes from, how I want to pursue it. I hope I get my questions all answered through this project, and thank you again, AOF, for supporting me and supporting all the others, orthodontic clinicians and faculty members, and thank you for AOF's dedication to our field. I'm really looking forward to doing this project. Thank you.